Hi, my name is Dr. Michael Vella. Topic tonight will be hip pain. Hip pain is a nebulous term because what exactly is the hip? The hip is that region of your upper thigh. It joins the spine. Some of the pain is anterior or groin region. Some of the pain is at the side, and some of it is in the posterior region or the buttock region. Hip pain spans all ages. In the very young, it can be a dislocated hip at birth. It can be a septic arthritis or a viral infection of the hip. In the teen years, it can be problems with the growth plates causing a vascular necrosis. It can be problems with the actual head of the femur causing a slippage. It can be a deformity unnoted. It can be arthritis. And most commonly, if it is, it'll be as a result of either an unknown sepsis or an untreated rheumatoid arthritis. You see the inflammatory arthritis in the younger age groups more commonly than the osteoarthritis and the traumatic arthritis. From the teenage on, we dramatically changed to trauma, and the big topic would be wear and tear. Rheumatoid arthritis still plays a part. The sequela of earlier childhood and teen years are now beginning to show in the early 20s and 30s with arthritic problems. You may notice most commonly pain in the groin, difficulty ambulating, using what we call a waddling gait, where you're actually swinging your hips side to side. You may notice difficulty getting into a figure 4 position, such as crossing your leg and putting your ankle on your opposite knee. You may have difficulties tying your shoes. You may have difficulty donning your socks. The pain, as I said, is generally groin and inner thigh. It can be nocturnal. It can be with distance walking. It can be when you first got up in the morning and then walking, it slowed down. And those are predominantly pains around the true hip joint. Now let's talk a little bit more about the quote-unquote larger general view of the hip. There are things such as sciatica and low back pain, which give you more buttock and posterior hip pain, which can radiate down the posterior or the back of the thigh into the calf and foot. Many patients will call that hip pain, and indeed it is, but it isn't the joint pain that most of the hip surgeons are interested in. The lateral pain can come from several areas, or the pain in the side. Most typically is bursitis and different forms of tendonitis. Typically, lying on the bed on your affected side is an unpleasant experience, and you have to roll over or you have to get off that side. That is almost always a bursitis, and we see that in the older age range and in predominantly females. One of the other is anterior thigh pain, which could be a hernia, and that is again still groin areas, but it is not the true hip joint. If you rotate the hip joint from side to side in a seated position and swing your foot to the left and to the right, and you have no pain, that is a good indicator that it may be something else besides hip joint pain. What are some other causes of global hip pain? Tendonitis, such as a flexor tendon or extensor tendon of the quad, flexor tendon of the hip. Sometimes direct blow trauma will cause muscle bruising and pain with motion. Again, it depends on where the pain is, and in general, the pain of the hip will be in groin pain. Again, checking your motion figure 4 position, walking, and seeing how that goes is generally a good indicator. Should this pain not subside, or should you have fevers or chills? If you have fevers or chills, or your child is having fevers or chills and complaining of hip pain, you should seek medical attention urgently. This can be an infection. It may just be an acute inflammation, but you certainly don't want to miss an infection in a young age range or in the elderly. Some of the inflammatory diseases that affect the hip, the most common would be rheumatoid arthritis. You have also some of the crystalline arthropathies such as gout or pseudo-gout. Lupus would be another, or psoriasis, psoriatic arthritis is another form of inflammatory. The most common is degenerative arthritis or osteoarthritis from wear and tear. The next most common may be traumatic. The important part of perhaps the history is, what do my ancestors have? Have they had their hips replaced? Have they had problems? The adage of the acorn doesn't fall too far from the tree actually fits here to some degree. If you look at your family lineage, older brothers or sisters, and they've had knee or hip problems, it's not uncommon for you to have it if they do. Previous history of trauma, repetitive use injuries, baseball pitchers have a lot of hip problems besides other extremity problems. Those who work on hard floors and walking around a lot have hip problems. Previous dislocations or a high level of impact sports often have hip problems. The most common way of treating this is conservative, which will begin with anti-inflammatories and may go on to narcotic medicines. Once you reach the narcotics point, I really believe that you ought to consider replacement if x-rays and the proper diagnosis indicates. The injections of the hip can also be done. These are done with most likely a steroid medicine, of which there are several. You also use it as a diagnostic tool. And you're in end stage and ready for replacement, there are several types of materials that you can use with hip replacements. There's several approaches that you can use with to get to the hip. The most common would be the posterior. The second most common would be the lateral approach, and the anterior approach would be the third most common. There are different reasons for, and they have pros and cons. There's different reasons for using each. In terms of the materials used for hip replacement, we have everything from steels, titanium, ceramics, and ingrowth versus cemented, which are a large array in an armamentarium of an orthopedic surgeon. There are some minimally invasive approaches which we can always use with those materials, and one of the more recently popular procedures is a hip resurfacing. That is not as bone removing, it is more bone sparing. It has a limited use or a limited span of people that can be candidates, and therefore you must seek opinion and go and see someone who has experience with that. In all, you can expect, if everything goes well, about an 85% pain reduction, and hopefully ambulation without assisted devices. A lot of people have said to us that do these procedures that it's given them a new lease on life, and you can see the pain relieved in their faces. I'd be happy to entertain any questions. Look for us on the blog. Thank you.